Morning everyone. Today we will discuss about behavioral disorders. So today we will discuss about behavioral disorders. Definition. So behavioral disorder involves a pattern of disruptive behavior in children that lasts for at least 6 months and cause problem in school, at home, or in social situation. So what is disruptive behavior means? Disruptive means interruptions or disturbance. So which causes disturbance in a child's life, social life or life at school, which more than at least 6 months, which is known as behavioral disorder. There are few causes like faulty behavior of parents and faulty family environment, disability, physical as well as mental disability, sometimes peer pressure, effect of mass media. We can categorize behavioral disorder in these four categories, which is emotional deprivation, physical deprivation, social deprivation, and others. Here are few examples of emotional deprivations, few examples of physical deprivations. Here are some examples of social deprivations. So, first we talk about emotional deprivation. And first one is breath holding spell. What breath holding spell is when a child stops breathing up to 1 minute. In that case, child may lose his or her consciousness due to spells. It is most common between the age of 6 to 18 months of the child. Almost 5% of the pediatric population might demonstrate such episodes. You can see it is in the picture. There are two main types of breath holding spells, cyanotic spells or palate spell. The most common, approximately 85%, is cyanotic spell. It is caused by changes in usual breathing pattern of a child. Occurs when facial cyanosis is noticed after the child stops breathing, like the discoloration of lips you can see, and palate spell. It is associated with a sudden scare of the child, and child becomes extremely pale during this spell. There are few signs and symptoms of this. You can see stiff body, faster heartbeat, intense cry or sometimes no cry, long pauses between breaths, blue or purplish lips, fainting and or unconsciousness. The management should be, first of all, the child may fall down, so we have to prevent the child from hurting. Second, we have to lay him or her down. Usually child start breathing after 1 minute, but if not, immediately take him or her to the hospital or nearmost hospital. One more thing I want to notify to the parents that generally they think these spells are for attention seeking, but they should know that these are result of an involuntary reflex and the child has no ability to control them. So keep that in mind. Second one is tantrums or temper tantrums, which is very common. Sudden outburst or violent display of a child. Symptoms are loud cry, shouting, rolling on the floor, banging his head, or showing aggression, sometimes biting, throwing objects, etc. Management should be, I want to advise to the parent that ignore the child at that time, and after being calm, you should tell him that this kind of behavior is not acceptable. Don't ever beat the child for this kind of behavior. Always pay attention to him or her. And most importantly, be a good example. Never show, if you are showing tantrums, he's gonna do the same. Third one is jealousy or rivalry. It's very common, especially after the birth of a new baby. Symptoms should be aggressiveness, sudden aggressiveness or attention seeking, unnecessarily fighting with siblings, always comparing, always complaining about not being loved, or parents taking side of the sibling, or roughly handling of the younger child. The management should be give time to child, or I can say each and every child, pay attention. Never punish the child for being jealous. You have to console him and sort it out that he is having a misunderstanding, and you love him as compared the same at the level of the other one. Never compare them. Never ever compare them, and try to involve them in taking care of the younger ones in your guidance. Child love to take responsibilities, or so give them responsibility of their younger sibling. You can use them in helping changing diapers or taking care of his or her younger sibling. Due to physical deprivation, enuresis. Enuresis or bedwetting. It is considered enuresis after the age of 5 years. Repeated involuntary urination at the age in which bladder control should be established. Okay, there are two types of enuresis, primary or secondary. In primary, child never dry at night, and in secondary, loss of control after an initial bladder control for 6 months or sometimes more. Management should be first, we have to keep that in mind, and before labeling it a primary enuresis, diabetes, UTIs, or anomalies have to check. Okay, so and other problems should be ruled out. Make the child void before going to bed every night. Wake them up 1 or 2 times every night to void. Don't get don't give extra fluid at least 2 hours before going to the bed, and motivate them and reward them for dry nights. Consult a doctor if persists. If still the problem is persists, you need to consult the doctor for further examination. And coprasis, it is also known as soiling or fecal incontinence. Repeated passing of stool, usually involuntary, into clothing, usually occurs after 4 years of age. Management should be don't make the child feel guilty. Give child potty training but not wait 2 months straight. Make sure the child doesn't have some underlying emotional issues, and if he have, try to resolve them. Give some fibrous and healthy diet to the child. If still persist, visit a doctor for examination. Other one is pica, chronic ingestion of non-nutritive substance like mud, clay, plaster, insects, etc. is known as pica. It is very common. Here are some specific terms for different types of pica, or on the basis of the food or the thing it is the baby is consuming. Geophagia, consumption of mud, soil, clay, chalk, etc. Pagophagia, consumption of ice. Halophagia, consumption of glass, uncommon. Amylophagia, consumption of starch, wood, hairs, etc. After 2 years of age, if it's still present, then need some investigations. You need to investigate your child for iron deficiency, anemia, or calcium deficiency, or worm infestations, etc. Try to rule out the cause and then treat accordingly. Other one is tics. What are tics? What tics are sudden, repetitive, uncontrolled motor movement or sound are known as tics. It can occur in any body part. Boys have it more common than girls. There are many types of tics. Few common types are simple male grunting, yawning, grunting, blinking, stretching nose or head jerking or throat clearing or wrinkling, etc. Complex would be jumping, spinning, touching objects or people, or copropraxia, ecopraxia, etc. Management should be HRT, like habit reversal training. It's a behavior therapy and medication. Other one is thumb sucking. See, infant feel love and satisfaction and affection through sucking. But up to 4 years or sometimes more, it is known as it is a behavioral disorder. Sometimes it could be a sign of insecurity also. Management should be encourage the child to quit thumb sucking. Try to bond more deeply with the child. So if the reason is insecurity, uh, after you try to bond deeply, it would be no more. Parental counseling, behavioral therapy, abrasives. In this, applying fall tasting liquids on the thumb. You can see the nimbu patra or haridra sometimes, and thumb guards. It is available in market also, easily available. Other one is juvenile delinquency. It is also known as juvenile offending. Refers to criminal or antisocial activities of a child. Causes are bad company, faulty atmosphere at home, labeling, guardian's behavior, neighborhood, depression, and sometimes drugs. Intervention. Government have different law for minors. Government have juvenile correction homes for such children because they still have scope to be a better person, have proper guidance. Family should be a role model. You have to keep that in mind. Family should be a role model and supportive for a child. So be the one. Other one is autism spectrum disorder, also known as ASD. Autism is a term derived from Greek term autos, which means self-isolated. Which means autism is a condition in which person is away from social and emotional interaction. Spectrum means wide range of symptoms. Okay, here are some causes. There could be many reasons behind it. Some are genetics, epigenetics, prenatal, like diabetic mother, or some infections like TORCH, etc. Some medicines, teratogens, etc. Symptoms are silent symptoms of ASD are wide. All children affected with ASD will suffer from these at some degree. Some may have mild impairment and other one may have multiple, but at least at some degree, child will have problem. The main problem areas are social, language, movement, and learning. There are few symptoms like avoidance of eye contact or poor eye contact, behavioral disturbances, delay in learning to speak, inappropriate social interactions, intense focus on one topic, lack of understanding of social cues, not engaging in play with peers, or repetitive movements, repeating words, sleep disturbances, social withdrawal. These are some two symptoms. This is a chart where you can see how to diagnose. Like by 6 months, if a child is giving no smiles, uh, it is a thing to concern. You have to look for autism. Or by 18 months, if he or her is saying no meaningful word, it should be considered for it should be taken care of, and doesn't above at the age of 9 months doesn't initiate sound or gestures, or up to 12 months no response to name or no babbling, or doesn't play peekaboo, then it may be the symptoms or early signs for autism, and you have to check that. Okay, here are few early signs of autism. More signs of autism are inability to relate to others, hyperactivity or passivity, or unusual behavior or body movements, poor speech or lack of speech. So what would be the management? First, educational interventions, which include speech therapies, behavioral analysis, occupational therapies, physical therapies, or other is medical management. So all these therapies can be helpful in the management of autism. I want to give a message to parents that stick to a schedule. The children with autism give better results when the parents try to stick them to a schedule. Second is reward for every task done and reward them for their good behavior. Be patient with them. And the last but not least, give time and attention to them. In my opinion, each and every child show show in multiple ways that they need attention, they need love, they need care of their parents. So every day in 100 small ways, our child asks Do you see me or do you hear me or do I matter? Their behavior often reflects our response. And before thanking you, I would like to tell you that Ayurveda offers tremendous options for the treatment of behavioral disorder in the form of panchakarma, in the form of medicines, in the form of sattva-vajaya chikitsa also. We have seen very wonderful results to many patients of behavioral disorders with the help of Ayurveda and panchakarma. So at last, thank you. Thank you so much.